There's been decades of studies and research from various different academic institutions just showing the significant impact that consuming pornography online is having on individuals, relationships and society. But one of the things that's also been documented quite well is just the addictive nature of pornography. So what happens if you or someone you know is in that situation? Well, we're going to be talking about that next with my guest, addiction counsellor Susan Byrne, and psychotherapist. Susan, first of all, let's start off with what we know about the addiction that some people might have to pornography. Presumably it's something that has increased a lot as we have, you know, with our phones, we have access to pornography anywhere, anytime, any place.
Hi Wendy, good morning to you, and thank you for having me on this morning to discuss this issue of pornography that really isn't talked about enough. I just wanted to share one statistic first of all with your listeners, and it was a study that was completed in 2019, so it's only a couple of years old, and it was conducted by the Active Consent Programme at the School of Psychology in NUI Galway. And it showed that almost 60% of teenage boys saw porn before the age of 13, and 99% of boys saw porn before the age of 18. Now, those figures are quite shocking, and we know definitely they would have increased in the last 2 years. And that study doesn't even take into account of what age girls or percentages that girls have seen pornography at, first of all. And we do know in a porn addiction, it is a compulsive and impulsive, self-rewarding and mood-altering behaviour. And the two key words in that sentence, Wendy, are compulsive and impulsive, because addictions, as we know, are a very gradual and slow process that evolve over quite a lengthy period of time. But the two key components of them are the impulsivity and the compulsivity. And with porn addiction is about avoiding reality, and it completely cripples and disables someone to recognise what is real and what is not real, because what they're looking at in pornography is fantasy. And because they can't decipher between what is real and what is not real, it makes life really, really difficult for them to cope with. And I'm talking about day-to-day coping mechanisms with normal stuff. It would literally render someone dysfunctional, and what that basically means that they're finding normal day-to-day activities difficult to complete. And, you know, with family members, work obligations, college obligations, it almost becomes impossible.
And that's before, Susan, we even probably scratched the surface on, I mean, just when you're mentioning there the statistics of exposure to pornography for young boys when they're developing in so many different ways, and the fact that the vast majority of content on the internet, violence towards women, all the sorts of themes that are out there, sex trafficking of minors, all that sort of stuff obviously will have an impact on relationships and, you know, how we view one another. So it's more than just an addiction, do you think, in terms of all the other issues around it?
Oh, absolutely, Wendy. Yeah, absolutely. I mean, there are things to take into account of, you know, when young people are viewing this, you need to ask questions like, are they real actors? Are they porn actors? Or are they trafficked? Are these young girls been trafficked? Is there coercive behaviour? Or do some of them have drug, issues? And we need to look also at the impact of a porn addiction. And psychologically, you've got things like distorted thinking. And then you have, brain chemistry is changing, or pathways have been changed. Physiologically, you're looking at erectile dysfunction in men. Emotionally, you've got issues like depression and anxiety and intrusive thoughts, and as I mentioned before, the impulsivity and compulsivity of the nature. But Wendy, what I would say to your listeners is this: addiction, or pornography addiction and pornography viewing, has been around for a long time, and it's going to be around for a long time. It's not going anywhere. And I feel what we need to do is, rather than doing the aggressive conversation about it's all bad, don't be viewing it, I think we need to tilt it on its slide a little bit. And we need to start having open and transparent conversations in the home first, and then in schools and colleges with our young teenagers. Because
that's probably part of the issue, Dr. Byrne, just in terms of surrounding porn consumption. There's obviously a shame factor, and it's not something that you would sit and do if your mother was with you, your sister, whoever. Okay, so that shame, I would imagine, in some instances, helps to fuel this addiction, because you're not going to talk about it in an open way, and in some ways ways, I think part of our culture, we almost kind of laugh it off. When I would say there's a huge number of people, men and women, who suffer with some level of addiction because of the impact it's having on our brains and how accessible it is. So what's the best thing to do about it? You know, what is there a treatment? Is there a way of kind of breaking free?
Yeah, and you know, you've just hit the nail on the head. Out of all the addictions, pornography addiction is the most secretive because of the shame factor surrounding it. It's so much easier to come out and say I have an issue with alcohol, or I have a problem with gambling, or an eating disorder. But the pornography addiction is the most secret. But you know, we talk about porn literacy, it's the term we use, and in porn literacy what we're looking to do is educate young people, and what that basically means is developing a young person's critical thinking skills and their self-reflective skills on what they consider is sexually explicit and what they're viewing. And what we're trying to do is to teach young people to recognise what is aggressive and a violent behaviour, or what is a coercive behaviour, and to show them through education that it's not acceptable and therefore it shouldn't be normalised. And to ask questions of young people: what is their definition of intimacy? What is their definition of a healthy and happy sexual relationship? And also, what is their definition of an unhealthy and unhappy sexual relationship?
Yeah, and talking about it, what would you say then, or what are the steps, Susan, if there is an individual listening, or indeed it could be a parent who knows this is a problem for me, but I'm embarrassed, I don't know how to start the process of wanting to end this addiction. Where do you start?
Okay, well, I would say the first port of call is to talk to somebody. So set up an appointment with a therapist, an addiction counsellor. The treatment usually involved in that is cognitive behavioural therapy, which has been shown to be very effective in all the addictions. I would also suggest SLAA meetings. That stands for Sex and Love Addicts Anonymous. So they work along the same lines of AA and GA. So you have support and you have a sponsor. Medication sometimes is part of the treatment plan, because what medication does is it stabilises somebody, and that will be necessary if you have somebody presenting with the pornography addiction and anxiety and depression. Family support is huge, but the big piece, Wendy, is the educational pillar. The educational piece is what people need to understand.
Yeah, and that's where the talking about it comes in. Well, I know there's so much to this particular topic, Dr. Byrne, but you've got us certainly thinking about it today. Thanks for joining us on the programme today. That's Dr. Susan Byrne from the Connolly Counselling Centre.